So yeah, this is part one, how the vaccines work, and Dr. Peter Tesler will do this section.
Good evening, everybody. Thank you for joining us, and I want to thank CIANA for this opportunity. As was mentioned, my name is Dr. Peter Tesler. I'm the Regional Medical Director of Gotham Health Roosevelt, where we have sites in Queens and Staten Island. And I'm really thrilled to be here tonight to be able to speak about vaccines and how important it is that everyone receives a COVID vaccination. That really is, as everyone has heard, all over the news, all over everywhere. It's our biggest public health crisis, I think, in my lifetime, perhaps. And the key to our success is our vaccination efforts and making sure that everyone receives a vaccine. So I want to talk tonight about the vaccines and how important it is to get them, and to talk about answer your questions and give you a little education on the vaccine. So a lot of these things you've heard in the news, but I want to just talk about your concerns and answer the questions. So when we say vaccine, we're really talking about the coronavirus vaccine that's out there. And there are 3 of them right now in the United States. And these vaccines are effective and they are safe. And as I mentioned, they are our most important tool to end this coronavirus pandemic. And it's the key to reopening both New York City and the rest of the country. When you are fully vaccinated, you're safer. Everyone else is safer as well. There are going to be things you can and can't do with the vaccines, and when you have been vaccinated. But the key point is that you need to continue to be careful both before you're vaccinated and after you're vaccinated. And the website there, nyc.gov/COVID vaccine, can give you more information. Next slide. I hope. There we go. So we mentioned that there are 3 vaccines. There's the Pfizer vaccine and the Moderna vaccine. If you're choosing to get one of those, you need to get 2 doses of the vaccine. The Pfizer vaccine has a dose, and then 21 days later, you are to get a second dose. The Moderna vaccine, you get a dose, and 28 days later, you get your second dose. The J&J product only requires 1 vaccine. Sometimes people can't quite get there on day 21 and 28, so we really want folks to be vaccinated at least 42 days within getting these vaccines. But even if that doesn't happen, you should still get it as soon as possible, as close as you can to those 42 days. And if you're getting a vaccine and then another one, you will be given a vaccination card with your first dose. And if you need to get a second dose, you need to bring that card back so they can update it. So both of your vaccine doses will be on your vaccination card. Next slide. A lot of people are worried about the side effects of any of these vaccines, and most of the side effects are similar to the side effects that you have with any vaccine. Certainly, I'm a pediatrician actually, and with the childhood vaccines that, again, most of you had, you can have the same side effects. Your arm can get sore, you may be a little achy, you may be tired, have a little fever or headache for a few days, especially after the second dose. Over-the-counter pain medicines like Tylenol or Advil can help relieve some of these side effects after you get the shot. So we often encourage people after they get the shot, if they're uncomfortable, to be taking some Tylenol or Advil. If you have any more serious side effects, that's rare, but if that happens, and it can happen, then you should call your healthcare provider and get the best guidance that you can from that provider. Next slide. So as soon as you get the first vaccine, your body starts to work to help protect you, and that takes some time, and people are considered fully vaccinated 2 weeks after the second dose, if you get the Pfizer or Moderna, or 2 weeks after your first dose of the J&J, and by then your body has mounted a full response and you're as protected as you can be at that point in time. And then again, when you're fully vaccinated, you're safer. The vaccine does not 100% stop you from getting coronavirus. What the vaccines do is they protect you if you do get sick or you do get exposed to the coronavirus. People may have heard or seen in the news, all viruses sort of change over time. We have a different flu shot every year because the flu changes every year. Viruses change as well. This coronavirus is changing, mutating, and there are different types of coronavirus out there. One of them you may have heard about in the news is the Delta variety, and that one is the most common one right now, and it's very easy to get or be exposed to the Delta virus. It's very catchy. And, slides just left.
1 second.
So now you should be able to.
You may be exposed to someone with coronavirus after you've been vaccinated, and you may even have a positive coronavirus test after you've been vaccinated. But what it should stop you from happening, and it's really good at, is stopping you from getting really sick and stopping you from dying. And we still have people in this country dying every day. But I think the latest statistic that I saw was that 99.5% of the people who are dying are people who haven't been vaccinated. So again, the vaccines won't stop you from being exposed to it. They won't stop you maybe even from getting it, but they will stop you and stop very well you from being sick and from dying. Next slide. I think I'm handing this off to.
Yeah. So now we'll have Perla from Make the Road present information on accessibility for new Americans. So Perla wants to start.
Yeah, absolutely. Thank you. My name is Perla Silva from Make the Road, New York. Could you hear me? Good, clear? Okay. We work really close with our community members, and there's still a large amount of people that do want to get vaccinated or are just, don't know enough information. So that's our job, to be able to reach out to the community and make sure that they know where to get vaccinated, and especially our immigrant community. Our immigrant community is a huge target that is still with thoughts and fears of the vaccine. As many of us already know, but we like to remind our immigrant community members, remind them, please, that it is a free vaccine. There is no charge, no cost, of course. And if they do hear of a type of somebody trying to charge them for something, there is a hotline that they could actually report this, because it's very important that the New York City is notified about these frauds that are targeting our communities that don't know that it is completely free. As many of us already know, all Americans, residents that live in the in New York City, 12 years older are eligible to get the vaccine. 12 years to 17 are only eligible for Pfizer. Everybody else, 18 and over, can still get Johnson & Johnson or Moderna. So as of right now, only 12 to 17 can only get Pfizer if they wish to get vaccinated. One of the main resources that I love to tell people, and sometimes they forget, the main phone number for to make an appointment if they like to call to get a vaccine. You can actually get the vaccine to your house if you call the number. So anybody who is 12 years of age and above can actually get vaccinated at home if they wish. I love to give that information, especially for our families that have multiple children, so they don't have to leave the house or travel or anything. So it's very important that they can stay home And they can notify, hey, the vaccine is for my 14-year-old, or hey, it's for my 12-year-old, and just have that conversation with the person as you schedule your vaccine at home. Very important of the documents that they need of right now. It's a larger list, and we will be specific on the next slide. Next slide. Cool. Yeah, we can leave it there. If you have your driver's license, the non-driver's ID, ID NYC right now is very important, and it's great. We work, Make the Road works very closely with the mayor, with the senators, and we make sure that we can't just advertise and tell them, hey, you can get vaccinated or you can do such and such with the ID NYC, when we know for months they weren't working, but we requested that, and they have opened up, and they are giving out many appointments, so you can receive your ID NYC now. So please let people know that they are working again to make an appointment. If they don't have any type of ID, they can obtain this ID. A U.S. passport, a valid foreign passport, is also very great to let them know that any foreign ID is actually valid for them to get vaccinated, as long as they have the date of birth. They don't have to require any longer their photo ID, but as long as it has the date of birth that is 12 years and above, they are eligible to get vaccinated. A certificate of their citizenship, a life insurance policy with the birthday. If for the youth, our community members our children, if their parent, guardian can prove maybe like a letter from school, or just write a letter, hey, this is my child, I give permission to XYZ get vaccinated, and maybe like a copy of their birth certificate to show their date of birth if they don't have a school ID. That's also really very helpful. And I think we can go back to the previous slides. Very important right now. There's a lot going on with our immigrant communities and ICE. It's very important that we notify them that ICE has declared that they will not attend any of our vaccine sites at all. At the beginning of the pandemic, the beginning of the vaccine, when it was distributed to our community, I know it's a little hard to trust the government. We know that, but they have kept the word. They have kept the word of they will not share your information, whether it's with the NYPD, ICE. They do not come anywhere near our vaccine sites, and the vaccine sites do not share any of the information. They have no right to share anybody's information. So it's something very secure. It's something very safe for anybody who has that fear or thought of the police targeting them. They won't. They don't allow that. They're not allowed to share any of your personal information. It's very important to remind them that you do not need a social security number. You do not need you don't need to give that information, especially over the phone. Sometimes we hear stories that somebody's like, hey, what is your last 4 digits of social security or your bank account or any of that? Those are red flags, and we need to report those and just remind our community members that we do not share any of this. Next slide. How to get the vaccine in New York City. As Dr. Tesler had shared earlier, we have a site we work with. It's very quickly. Now there's so many vaccines available. We know that, and it's super easy. You log in vaccinefinder.newyorkcity.gov, or you call the 877-VAX4-NYC. That's very specific because we also have a number for the whole state. So that would be the S instead of the C. So it's very important to remind people that the C is only for our 5 boroughs, and this is the number that they can call if they would like to make an appointment, so the nurse can actually come to their house and get the vaccine at home. So this is the same number. We have a lot of vaccine sites, and everybody knows the commercials, the advertisements, Instagram, Facebook, and there's so many things out there that people will that actually don't even know that what they can qualify for, and we could just let people know to check out, or they can call the same number. That hotline number is for anything, any questions, whether it's personal or for this information. What do I qualify for? Where should I go? Where if I'm interested in maybe getting tickets, or I heard something in the news, any of those questions or concerns, they should call the 877 VAX for NYC, and they will let them know what is available or closest to them. We also have a free car service that works with the New York City that is available to everyone that they could call. It's Curb, and they could call and they will be able to pick you up from your house and drop you off to any vaccine site if you were interested to, like, maybe go to Queens and get free Yankee tickets or something. Whatever it is that is more appealing to you, they will take you to the location and they will drop you off home as well. So it's very convenient. There's so many things that are open and free to the community, and they're still not aware of this. Next slide. I think that's it.
Now I want to talk a little bit about some of the questions people ask about the vaccine. Can the vaccine give me COVID-19? No, that is not how these vaccines work. How they work is actually pretty incredible and pretty complicated, but you won't get sick with coronavirus from these vaccines. Are there serious long-term side effects of COVID-19 vaccines? And like with any vaccines, very, 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 very rarely people have some side effects that are long-term, but that is a very, very, very small part of the time. And the CDC and the FDA and all the other agencies are going to continue to watch these vaccines because they're relatively new, but right now we think that they're pretty safe, and especially compared to getting coronavirus, they're extremely safe. And again, we are encouraging everyone to get one. Next slide. How are the vaccines developed so quickly? Are they safe? Again, they are safe and effective. Most people will have some mild side effects like a sore arm, maybe a little fever, maybe they'll get, their arm will hurt for a few days. For the most part, that's all that they will have, and there won't be any other safety problems. They were developed quickly because usually to get a vaccine out there takes years, but the science was already there, and a lot of the other process parts about getting things approved were rushed, but the science was not rushed, and the safety part was not rushed, which is why they seem so far to be very safe, and we're glad that we cut through all the bureaucracy to get them out fast. Next slide. Can I still get COVID-19 after getting the vaccine? And as we talked about before, you can. You may still have a COVID-19 positive test. You may still even be very slightly sick with COVID-19 after you get the vaccine, but you won't get really sick and you won't die if you get the vaccine. The vaccine doesn't stop it from being out there, and unfortunately, over the last weeks, especially with this new Delta type out there, more and more people are getting coronavirus now than there were a month ago. So the numbers are going in the wrong direction. So that's why it's so important for everyone to get the vaccine and be safe. And as we've been talking about tonight, it's pretty easy to get one. Most of New Yorkers have had a vaccine. The lines are no longer long. And if you go to that website, you can find one. And it's typically a walk-in service, and you don't have to wait too long. So it's easier than ever to get the vaccine right now. Next slide. Some of the reasons people worry about getting vaccine we're going to talk about. So should I get a COVID-19 vaccine if I am pregnant? And the answer is absolutely yes. There is no evidence or data to show that the vaccine can harm your pregnancy or that the vaccine can harm the baby. There is, unfortunately, a lot of evidence that shows that if you're pregnant and you get coronavirus, you don't do well. Pregnant women who get coronavirus are sicker than the average person who gets coronavirus. And there have been lots of pregnant women who've had a very, very difficult pregnancy and get very ill with coronavirus. So this is the one protection we have for both you and the baby. So absolutely, you should get coronavirus vaccine if you're pregnant. And will the vaccines affect my fertility, my ability to get pregnant, either now or in the future? There is nothing that has shown that this vaccine stops your ability to get pregnant either now or in the future. There's no evidence of that, so it's not a worry right now. Should I get the vaccine if I have a chronic illness? And the answer is absolutely. You should get it. Your mother, your father, your grandmother, your grandfather, anybody with any medical problems, high blood pressure, diabetes, heart issues, lung issues, all of those people who have some sort of medical problem do worse with coronavirus. They are at high risk to get very sick and to die, unfortunately. So the people we want to get the coronavirus the most are the elderly. They also don't do well. So if you're old, or if you know people who are old, and also anyone you know who has some sort of serious medical problem, they absolutely should get the vaccine, because if they get the virus, they're going to do badly. Next slide, or is that the last? So that's all I have to say about the vaccines right now.
Yeah, thank you so much, Dr. Tesler and Perla. I think now we're going to open up the question and answer section for the final part of the workshop. So if any audience members have any questions, please use the raise your hand feature by clicking on the hand icon at the bottom of your screen, and I'll call on you and you can tell us your question, and hopefully we can give you a great answer. Okay, I think Joe has a question. If you want to share, Joe.
Hi, Doctor. Thank you very much for presenting tonight. This was really very informative. I have a question, though, about these variants and how worried should we be? I know that a lot of states are now coming out with mask mandates again, and it's just really worrisome. Should we be vigilant again like we were last year, or how do we approach this?
Well, I think, first of all, thank you for the question. And I think that's a great question. Everyone is worried about the new variants, and no one is quite sure as to what's going to happen in the fall and the winter. The numbers of infections are increasing, and as everyone may know, there's a lot of differences from state to state in terms of how many people are getting the vaccines and where they're spreading. But the numbers are going up. this isn't the last change in this virus that we're going to see. They keep talking about this Delta variant, but there's certainly others that may come and may arise over the next, 6 months to a year. So we may, unfortunately, in the future, have to take steps in the, what I would say, wrong direction in terms of being able to function like we used to. Mask mandates may come back. Other restrictions may come back. Our best defense for a person is to get, and for the community, is to be vaccinated and then follow whatever guidelines the departments of health are giving you about masking and other precautions.
Okay, great. Thank you very much. Appreciate it.
Does anyone else have any other questions? Please use the raise your hand feature once again. Okay, I think Mohammed has a question. If you wanna please go.
Yeah. So my question is that I just lost it actually. So recently I was talking with a lot of my family members who are, like first generation, or like not, like they're new to this country or not familiar with vaccines or stuff like that, and they kind of had a hard time trying to understand why they need the vaccine or something like that. Like, why is it mandated? I don't know. It's like, how would you approach trying to convince someone who is more traditional in the sense, not familiar with vaccines, maybe not that knowledgeable about, the science behind it, especially when their community is not really like targeted for vaccinations and stuff, like vaccine education?
I think how I would approach that, and again, thank you for the question, is to really, have them talk to both people in their community around them and from wherever they've been, wherever they come from. All across the world, communities have shut down and people are dying, unfortunately. And I don't think there's any better evidence to think about how important it is for people to get vaccinated is to just sort of look at how many millions of people, have died because of this coronavirus. I mean, that to me is, I think, a winning argument that there isn't a country that hasn't had people die, and there isn't a country that hasn't had people get sick and get really sick. So wherever they're from, back at home, people are dying and people are in the hospitals. So yet they're very lucky because, again, in the United States, we do have the vaccine. Not every country, and a lot of countries don't have nearly enough vaccine, and people are begging to get the opportunity to have a shot, to have a vaccine that would protect them. So the coronavirus is here. It's in New York City. So again, their protection is to get vaccinated because it'll stop them from dying or the potential of dying or getting very sick. That would be my approach.
Yeah.
Thank you.
I would like to add, because I absolutely understand where you're coming from, Mohammed, and thank you for sharing. I think that, yeah, we, the way we approach our certain community members in this situation, and they're like, most importantly, we respect them, their decisions, their body, their religion, and everything. But I think it's very helpful when, we can't just tell people what to do, or we can't tell them this is what it is. I think it's best when they like join a group or they join their own community sites, and if they have access to these organizations or churches or wherever makes them more comfortable, and they hear it from their own, that opens their mind a lot much more than a stranger just coming in like, hey, let me educate you, because that's not going to work. But we definitely see that most of the times they feel more comfortable within their own circle, within our own community members. They're willing to just hear each other out more. So that could be a great approach for whether it's for your friends, family, just do a little research on where they could feel more comfortable to joining this group, and they can just be part of it together.
Thank you so much.
Are there any other questions from the audience? Please feel free to, once again, raise the hands using the icon at the bottom of your screen. Any last questions at all? Okay. Well, I think that's it. So at this point, we're going to wrap up our workshop. Thank you to everyone who participated, and thank you to Dr. Tesler and Perla for taking the time to share this valuable information and make sure all New Yorkers get vaccinated. And please keep an eye out on our website, www.cianainc.org, and our social media. All the handles are at CIANA Inc. For the recording of this workshop. And please feel free to share it with anyone who you think is hesitant to get vaccinated and might benefit from the information that was presented tonight. And please feel free to contact us with any questions you have about any of the information presented today, or if you have any other immigration health-related needs at all. So yeah, thank you so much, everyone, and have a great evening.
Thank you.
Yeah, thank you, Perla and Dr. Tesler, especially.
Yeah, thank you.
My pleasure.
Have a wonderful night.
Thank you. Have
Everybody
a good
get vaccinated. Good night.
Good night.
Thank you.